Hi, I'm Dr. Eric Burgess from the Burgess Center for Cosmetic Dentistry, and I want to talk a little bit about teeth whitening, which is one of the most common, most requested, most demanded procedures we do, and one of the simplest, easiest ways to kind of start your journey into cosmetic dentistry and improve your smile. There are different types of whitening products. There are things you can buy over the counter, and there are things you can get through the dental office. And just to explain the difference between those, the stuff you get over the counter, it will work to an extent. It is a little bit more acidic. It doesn't have properly sealing trays. There are things that kind of hinder them from being as effective. The concentrations aren't as strong, but you can get some improvement by doing something like that. But to really get a professional, knock your socks off quality whitening result, you've got to get it done through the dental office. And the reason why is we have different options for each person, and I always tell patients that out of all the things we do in cosmetic dentistry, the most unpredictable thing we do is bleaching, and it varies for everybody. The reason why is that your teeth have two different layers to them. They have your enamel on the outside, which is kind of like your glass layer, and then you have your dentin on the inside, which is your yellow, brown, grayish type color that most people have. That's the inside layer. So those two things play into the color spectrum. Most people have staining discoloration from coffee and tea and wine and pasta sauce, things along those lines that will kind of soak into the pores of your tooth and yellow it up. And the idea of whitening is we're trying to remove that from the outer part of the tooth. So the layer of the enamel makes a big difference on what color you see the tooth, whether it's coming from the inside of the tooth or the outside of the tooth, the staining. If your enamel is more clear, the color is coming more from the inside, the results won't be as good as you're hoping for. Everybody gets whiter, but maybe not as white as you'd like to be. If your enamel is more like frosted glass, the light doesn't penetrate as much, so the color from the inside of the tooth isn't coming through. That is the kind of result you'll get the maximum whiteness with. So that's part of something that only we can tell. Another consideration for whitening is that you could have cavities, you could have restorations, fillings that are different colors. Those kind of things don't whiten. So you have to understand that when you whiten your teeth, you get a result from the teeth being whiter, but fillings don't change, crowns don't change. So you want to know going into it whether it's going to be a very simple whitening, or you want to know whether it's going to be something that's going to cost you thousands of dollars to replace crowns and fillings and stuff. So that's something else you'll get from coming to a dental office. Third thing you'll also see is we look for things like cavities. We look for things like gum recession. Those are things that are going to be sensitive. You could possibly cause damage to the nerve if you're using a solution of whitening product it gets too close to the nerve. That can also affect the tooth and possibly cause people to have abscesses or root canals or things like that. So you just don't want to just pretend like this is a cosmetic that you buy over the counter or something like that. There are some factors, health-wise, comfort-wise, that you have to consider that only we can do through a dental office. Here at the Burgess Center for Cosmetic Dentistry, we have different options for whitening depending on your situation, depending on the types of fillings you have in the mouth, the type of staining you have, depending on whether it's inside the tooth, outside the tooth. All these things are kind of factors that come to play when we're deciding on what to use on you. First, there is something called tray whitening or take-home whitening. Most people are familiar with this because it involves something simple as a little plastic tray. We take an impression of your teeth. It's very flexible, very comfortable, something most people have seen. There are things you can buy over the counter that don't fit as well, but part of the process is the oxidation of the teeth or the whitening of the teeth has to be forced into the teeth. So you need something that fits very comfortably, very exacting and so forth. So this is what we usually use. And what it usually comes with is a set of tubes that basically will mix up the solution. So there's two sides to it, a little tip that has a spiral in it, and when you squirt the stuff into the tray, you will actually get an activation of the material and you'll get a whitening result and everything. The second option we have is something called Zoom, which is an in-office laser type powered light that will actually activate the material, and we use a much stronger solution and get an even more phenomenal result for you. It's a little bit more complex in the sense that you have to come to the office, sit in the chair for about an hour or so. We have Tempur-Pedic mattresses, we have TVs in the ceiling, headphones, things like that to keep you occupied and distracted. And we'll actually protect your teeth and your gums by putting a kind of a translucent layer of resin over your gums so nothing will get onto them. We'll put this light here on them and you sit there for about an hour. Just watch TV, relax, very simple, very easy. When you sit up at the end, you got your result and you're happy and you're smiling and you're got a great white smile. There's a third option we do sometimes, and this is for very difficult teeth. There are people that have tetracycline type staining from medications that will be incorporated in the tooth. It's an internal color. These are the least effective type of teeth that we can bleach. What's nice about this technique, and we call it the deep bleach technique, is it combines both the other ones that we discussed earlier. One is the tray whitening, and two is the Zoom in-office whitening. So what happens with this is it's kind of a combination. We do a Zoom appointment at the beginning. We whiten your teeth as much as possible. It will condition your teeth to accept some more whitening solution. Then we also make you some custom trays and give you some solution to go home with. There's a whitening process that goes on for about 2 to 3 weeks. After 2 to 3 weeks, you come back, do a second Zoom session, and you'll get a similar result than that most people would get from whitening who had very simple staining on their teeth, not deep ingrained tetracycline type staining. It's very, very, very difficult to do that. Most people don't usually do the deep bleaching technique because it's a very complex, and most people think that you can't get a result on those type of teeth. We've seen phenomenal results here over the years. So this is something I want to give people hope for, people who don't think that they can whiten their teeth. This is the best way to do it. It's kind of a combination, again, of the Zoom in-office whitening and the home whitening. Between the two of those, you get a nice result. The final thing you have to think about with whitening is maintenance. And when you maintain your teeth, you also have to consider the fact that you're constantly putting things in your mouth that have color to it. And like I said earlier, coffee and tea and wine and things along those lines. It's a process. You can't turn around and think I've whitened my teeth and I'm good for the next 5 years. You have to maintain it. The easiest thing for most people to maintain it is to consider it every 6 months roughly. Most people will get a hygiene appointment. It's an easy reminder. I just got my teeth cleaned. There's no stain in my teeth. There's no tartar on my teeth. This is the time I can do some whitening and maintain it better than any other time. And it's an easy reminder. So most of the patients will have the comfort trays. They'll put a little bit of gel in there for 30 minutes that one night when they have their teeth clean. Maybe the next morning they'll put it in for another 30 minutes when they're showering or getting ready for work. And in the end, they don't have to touch it again for another 6 months. It's a very, very easy, simple way to kind of maintain your teeth.